Hello, everyone. I'm here with Dr. Bryan today, and we're going to be talking about autoimmune conditions, depression, neurotransmitters, and how to fix these things, the core problems with autoimmune, and how to get to the bottom of it. Welcome, Dr. Bryan. I would love to hear your story on why you decided to specialize with autoimmune conditions and what you offer.
Sure. Several years ago in my practice, I've been practicing for a little over 11 years now. And a couple of years into practice, I started working with patients who were suffering from really complex, complicated conditions. So some people use the term complex chronic illness to describe this, where they have a lot of different conditions going on, a lot of different symptoms. And maybe most importantly, they've worked with a lot of different healthcare practitioners up to the point where they came in to see me. And by starting to work with those more complicated cases, it really forced me to learn a lot, study a lot of different areas with a lot of different doctors and herbalists and acupuncturists and just people of all different stripes to basically develop the diagnostic abilities and the treatment tools to be able to help those patients. And as you might expect, a lot of those patients had and have underlying autoimmune conditions. So a lot of them would have diagnoses of things like Hashimoto's, rheumatoid arthritis, lupus, MS. And some folks just had these what they would call an idiopathic autoimmune disorder. So meaning that their rheumatologist or other specialists would say, we know you have some kind of autoimmune thing going on, but we don't actually have a label for it. So we're just going to call it an idiopathic, meaning we don't know what causes it, autoimmune condition, and that's what we think you have. And then the patient would say, what do we do about it? And they say, we don't know. And then they wind up in my office. So that's ultimately what led to me working with a lot of folks who have an autoimmune label in my practice.
I see. So what have you seen that basically are like the triggers of these conditions?
So it's a really good question. And, I'm ultimately have a scientific mind at heart. I'm a very left-brained guy. So, my answer really has to be, I don't know for sure, because until there's enough double-blind, placebo-controlled trials telling us exactly what's causing a given condition, I really have to say, pardon me, it's, based on what I've seen in clinical practice, my prevailing theories as to what's driving this is what I'm about to say. So just as a general caveat, I can't say that this is definitely what's causing these conditions, but what I've seen in clinical practice is a lot of folks who are dealing with autoimmunity, and specifically folks who are dealing with autoimmune conditions that aren't quote unquote easily treated. And by that I mean I've had patients in my practice, thankfully for them, thankfully for me, that are sometimes really, really easy to treat. You take gluten out of their diet, they feel 100%. You treat their IBS, their autoimmune symptoms totally go away. And that does happen from time to time. But as I understand, the audience that you do these interviews for, they've already done maybe all those basics. They're aware of all these things. And the sad reality of it is that a lot of folks can't get away with just modifying their diet, just, getting their gut healthier, treating their leaky gut or whatnot. A lot of them do, but at least in my practice, a lot of them don't. And so the underlying root causes that seem to drive a lot of those autoimmune cases that I work with revolve around things like chronic infections. So whether that's chronic viral infections with viruses like the Epstein-Barr virus, Coxsackie viruses, HHV6 virus, or it might be other infectious microbes like the Lyme disease causing bacteria known as Borrelia burgdorferi. There's certain microbes that are referred to as co-infections of the Lyme disease bacteria. So something called Bartonellosis, babesiosis, mycoplasmosis. So sometimes there are these chronic bacterial or viral or sometimes parasitic infections. Also, mold illness is something that I see a lot in my patients who are dealing with autoimmune diagnoses. Mold is something that really isn't talked about nearly as much as it should be, in my opinion. One of the running, not really haha funny jokes that I have, but one of the, I'll call it just a running joke, I guess, that we have within my clinic, like with me and my residents and some of my colleagues, is that it's really, really hard to get people to understand or realize that they may have been exposed to mold. On my intake forms, there's a section that says, have you ever lived or worked in a place that's moldy, musty, or water damaged? And people don't check the boxes off very often. But when they say, like I started getting sick after I worked at this place, or I started getting sick after living in this house or whatnot, I'll ask them questions saying, like, any history of water damage, any musty smell, any old building smell? And they're like, well, now that you mention it, yeah, like one time I was taking a bath and actually like put my foot through the wall because it was all eaten at with mold and we had to get the whole place condemned. And like they just don't really think about it because like, oh, it's mold, it's just a little bit stinky, what's the big deal? But mold mycotoxins are incredibly toxic to the human body. They can actually, some species of mold, it can be deadly to people, but mold mycotoxins are really, they're very good at creating a lot of inflammation in the body, and they're very good at creating hypersensitivity in the body, meaning that they can drive those allergic or autoimmune, hypersensitivity types of reactions. So mold illness is something that's unfortunately very common and very underdiagnosed, underrecognized, underappreciated, I think. So in addition to the chronic infections that I mentioned, in addition to mold illness, sometimes there are other issues with more maybe challenging to treat gastrointestinal issues. There's a condition called small intestine bacterial overgrowth, also known as SIBO or SIBO, that's relatively common. Sometimes people have a related condition called SIFO, which is small intestine fungal overgrowth, which is a little bit of a weird name because it's actually a candida yeast overgrowth in the small intestine, but they call it SIFO nonetheless. So sometimes there are those underlying digestive overgrowths that can be a factor. And then sometimes there are issues with the patient's detoxification functions. So there's something called the methylation cycle, which is very important for a wide range of physiological pathways in the body. But in particular, it's very important for detoxification systems. When you're not methylating well, you can't get rid of synthetic chemicals / toxins very well. You can't get rid of heavy metals as easily. So you start to bioaccumulate these things, and things like chemical toxins, heavy metals, things like that can also contribute to underlying sort of pathophysiological processes that might drive the autoimmune processes in a given individual. So those are kind of the broad umbrella spectrum of things that could be driving this type of process. And indeed, in some of the most challenging cases, the most symptomatic cases, they have more than one of the above that's affecting them.
Wow. Yeah. I mean, I've had 4 autoimmune conditions. One many people know was very acute, and it was autoimmune hemolytic anemia, where I just passed out at a gym and someone had found me and they took me to an ER. It took them 3 days to find out what I had. And I was in a coma. I had no oxygen in my body. And I remember what really helped me was like oxygen baths, like oxygenated water. And I don't know how, but it helped me, I guess, get rid of some of this inflammation that I had. And I know that you offer hypobaric oxygen treatments, which are helpful, but in treating autoimmune conditions, is this something that you're seeing is lifelong, or do like patients kind of have it off and on, and like these sort of treatments help them sort of recover for a little bit? How are you seeing these treatments be effective?
So I kind of conceptualize it in 2 different categories. So there's the accelerator pedal treatments that help people to feel better and maybe ultimately get better faster. And then there's the treatments that are actually working on addressing the underlying causes of what's driving their symptom picture. So therapies like hyperbaric oxygen therapy, or there's another therapy to help more quickly oxygenate a person's system, which is part of me doing something called intravenous ozone therapy, which we do a lot of in our practice as well. Those are therapies that can, in some cases, make a really big difference for people. They can be game changers for some cases. They're not a magic bullet for everyone by any stretch of the imagination. I wish they were. I would take a magic bullet any day of the week. However, those therapies can be very helpful. Intravenous ozone therapy, as a case in point, it helps to modulate the immune system, which is exactly what you want when there's an autoimmune condition. It basically helps to balance the immune system. It's anti-inflammatory. It promotes tissue healing. It helps your mitochondria to make more energy, because the oxygen is oxygen is the final ingredient in the recipe for making oxygen, making energy in our cells, in our mitochondria. This stuff called ATP. And it's also antimicrobial to boot. So it does all these wonderful things. So if a person's inflamed, immune system's out of whack, there's infection going on, their mitochondria are running low, and so therefore they're feeling tired or brain foggy or both. It's a really great therapy to work with. And some people feel like it's just a game changer for them. But to your earlier point that you alluded to, is ozone therapy going to cure a person fully of their autoimmune condition? I would say very rarely. I mean, I haven't seen it happen, but as an accelerator pedal to help them feel better faster, it can help quite often. The other sort of category of treatment would be these therapies that are working to actually try to address the underlying root cause of what's going on. And that would be addressing the underlying infection or addressing the food sensitivities, getting the gut microbiome on track, getting rid of the mold and the mold mycotoxins, getting the methylation cycle working properly. And those are therapies that, in my experience, can get patients to the point where they are symptom-free, and then they can stay symptom-free. Granted, it's not necessarily I'm symptom free today and then I'm off all my supplements and treatments tomorrow and I'm good to go. Oftentimes there can be a weaning down process, or weaning off process rather. And then sometimes there are curveballs that come along. Sometimes patients are feeling fantastic. They've killed off the chronic virus issue or the chronic bacterial issue. They're feeling really good. And then they start to wean off their treatment and they start to feel worse. And so we put them back on the treatment. They're feeling better again. Maybe a month or so later, start weaning off, start feeling worse again. What's going on? Well, maybe they have something called a biofilm issue, where there are basically these polysaccharide proteinaceous compounds that are acting essentially as a hiding place or a reservoir for these microbes. And as soon as we take the pressure of, say, the antimicrobial treatments off, then more microbes come out of the woodwork saying, oh, it's safe now. I guess we can start infecting this poor person again. So there are curveballs that come along, but patients, in my experience, they can get symptom-free. Can you ever fully get rid of an autoimmune condition? Again, you know, the research out there just doesn't exist. There really isn't the assumption that there is a cure when you're looking through more of a conventional medical paradigm as a general rule. So to my understanding, there really haven't been those research dollars going into saying, you know, how can we say based on blood testing, et cetera, this person's definitively cured? But to my mind, if someone's asymptomatic, they're not requiring intensive ongoing treatment, their say antibody levels are going down, or maybe their anti-nuclear antibodies aren't testing anymore, or whatever it happens to be, I guess that's about as close to a cure as you might be able to expect. So that is something that can happen. Not that it happens in everybody easily by any stretch, but it is something that I have seen happen in patients in the past.
Wow. Yeah, I've seen, a lot of these temporary sort of treatments help, here and there and with symptoms. And then when it really comes to, fixing your gut microbiome and the diet and the supplements, it's like a lot of us sort of get so into that and they don't see results. I mean, you can follow everything to a T and get rid of all these infections, but the reality is that like every human being has infections, every human being has viruses. We all have zillions of these, bacteria in our body. So does it really make sense for us to get rid of them like one by one?
It's a good question, and I think it's a really good point to bring up because there are certainly clinicians out there, especially when it comes to infections like, say, persisting Lyme disease or chronic viruses or things like that, where kind of I would call it more like the old school general way of thinking was that, oh, we just need to get in there, obliterate everything, and then everything's going to be fine. And a lot of my mentors, I was fortunate enough, I guess, that a lot of my mentors who really blaze the trails of this area started finding over time that, like, yeah, some people you just hit them with enough antibiotics and they feel great, but then there's a lot of folks where that doesn't work. And so along the way, it kind of brought it to light that it's really not so much of a we just need to obliterate the bad guys and then things are good. It's more about, well, why did those bad guys, why were they able to get a foothold in the first place? What was going on with the microbiome? What was going on with this person's mental emotional state? What was going on with this person's detoxification capacity, nutritional status, all these things? And then did it just create this fertile breeding ground for these pathogenic microbes? And then even with, I'm even a little bit hesitant to use the term pathogenic microbe, because there is some evidence to suggest that maybe some of these microbes, the ones that we generally consider to be very bad, they might actually confer some benefits for us. A good example of that would be the herpes simplex virus, I believe it was. There was a paper that came out within the last couple of years, and nobody wants the herpes simplex virus because nobody wants cold sores or genital herpes, of course. But to my understanding, if you have sort of the right amount of herpes simplex virus in your body, it can actually have some neuroprotective effects on a person. However, if the person gets immunocompromised to a certain point, then it can actually potentially contribute towards neurodegeneration. So it's really this balancing act, and it does not make sense in my mind to say, oh, let's just kill everything that's, let's just kill, and then that's going to work it all out. It really is that addressing the root causes and all these various factors. You don't want to kill everything just indiscriminately, in my opinion.
That's what I thought as well, because a lot of doctors I had gone to for help, they had told me, hey, let's kill the HHV6 virus, let's kill, this virus and this bacteria, and oh, you have all this fungus. And it kind of didn't make sense to me to kill everything off like one by one. I just wanted to know, how can I just make my immune system more resilient to all of these different things? And I think that's what you help a lot of your patients do, right?
Yeah, in essence, yes. And pardon me, what I find to be really interesting is that we do a fair bit of diagnostic testing, not nearly as much as we'd like to do because the tests are just really expensive. I don't treat a high income population, so it's always really, we always have to be really mindful of the dollars and cents of what everything's going to cost. But we do, in the grand scheme of things, still do a fair bit of testing. Like I've done a fair bit of it over time. And what's always interesting to me is that sometimes we'll have these lab panels come back saying you've got the HHV6 or you've got the Coxsackie or you've got the whatever, and then we'll treat for it. And sometimes it makes a significant difference. Sometimes it's a game changer. Sometimes it resolves 25% of their symptoms, and sometimes it doesn't do anything. And I find that to be interesting because to my mind, it's still the proof's in the pudding. Like, you got the test and maybe that makes sense as a cause of what's going on. But if it doesn't make you better, then maybe that virus is just, that titer's elevated because there's something else going on. And so, we're not going to spend 6 months just trying to throw every different herb or every different treatment at to say, we just got to, obliterate that virus. The body's going to tell you pretty quickly whether you're on the right track or not. And so it's really not a one size fits all protocol. Unfortunately, I wish it was so much easier for everybody, but definitely not.
So how do you, with all these different triggers we talked about, how do you help a person? What's your process of helping a person figure out what their trigger is?
It's a really good question, because without the luxury of running a gamut of tests on every single patient, when that's not an option, then really the only other option is to be very mindful about the clinical clues that are gleaned from talking to the patient, at the first visit and on subsequent visits, to try to figure out what might be the most likely culprit as to what's going on. So just as a few general examples, if a patient comes in saying, I feel notably better when I'm avoiding complex carbohydrates. I just find that if I eat bread and things like that, and maybe not just bread, but like anything that's higher in complex carbs, like I definitely feel worse, I get more brain fog, etc. It's like, well, that's something that's pretty common when somebody has a SIBO issue. So maybe that's a clue that maybe SIBO is something we should look at. And if the patient also happens to have constipation or diarrhea or a mix of both, and they're really bloated and a bunch of gastrointestinal symptoms, that would be enough of a symptom picture for me to say, maybe we want to either do an empirical treatment for that, or we want to do a test. On the flip side, if somebody said, I worked in this place, and within a year of working there, I developed chronic sinus issues and maybe some breathing issues, and I developed some heart palpitations, and I get rashes easily now, be thinking maybe you have mold toxicity because you were working, and ask about the building, and maybe it was a musty school, which is relatively common here in where I live anyways, unfortunately, some of the older buildings, or it's an old government building or something like that. It's like, yeah, it sounds like there may have been mold there. And now you have these fairly classic mold-related symptoms affecting your respiratory tract. And then the fact that you're getting these heart palpitations, you're getting rashes, well, it sounds like you might have some degree of mast cell activation syndrome now, or some histamine intolerance, and that's something that can be perpetuated by mold. So that would be enough of a clinical picture for me to say, maybe we should do a nasal swab and culture, maybe we should do a test, or maybe we should just do a therapeutic trial where we, spray some antimicrobials up your nose and see how you feel. And then, conversely, if somebody said I, had a history of mono and, I just never felt better since then, it's like, well, that would suggest maybe there's a persisting Epstein-Barr virus issue and there's something going on there. So there's a bunch of clinical clues. Those are just a few examples of, what the patient's going to tell me and the questions I'm going to ask to try to figure out what the most likely culprit or culprits might be. And oftentimes when we finish chatting, especially for the most complicated cases that I work with, sometimes I have in my little, list on my, well, I used to write my charts, but now, so I used to have a sidebar, but now it's, a section at the bottom of my electronic chart saying, well, I think this patient might have mold and maybe infections and maybe methylation issues and maybe heavy metals and maybe mitochondrial dysfunction and so on and so forth. So kind of a list of what might be going on. And if there's multiple things, then we're not going to treat everything all at once, because that's not going to work. If we try to put a patient on too many treatments simultaneously, if they're getting better, we're not going to know what's getting them better. If they get worse, we're not going to know what's flaring them up. And so we have to, at that point, look at the list and say, well, what makes the most sense to treat first? If they have digestive issues and a bunch of other stuff going on, I'm probably going to recommend that we figure out if they have SIBO or SIFO or LIBO or yeast overgrowth or whatever it is first, because if they do, that's going to be driving a lot of inflammation in their body, a lot of malabsorption. Any subsequent treatments I work with are probably not going to work as well. So I'm probably going to start there. And then once we start there and we see, how are you feeling now? We've been treating your SIBO that you tested positive for a month. How are you feeling now? Oh, your energy is 25% better. Your guts never felt better before. Your joint pain is, not affected at all. It's just as bad as it ever was. Okay, so now we know that we've at least, sort of leveled the playing field a little bit. And now, given what symptoms are left and most prevalent or prominent, maybe now we'll move on to the next thing, either through a test or a therapeutic trial or whatever it happens to be. But it's kind of just looking at what the patient's experiencing, what gets better along the way or gets worse along the way. And then from there, figuring out what the next step might be. But it's really like peeling back layers is really the best way to describe it.
I see. So when somebody comes to you, because a lot of the women I work with, they have SIBO, they have IBS, and they have these sort of issues in the gut. How do you help them? Do you just give them a good diet and here are some supplements and you're ready to go, or are there other options?
That's a good question. So it would really depend on the type of SIBO that was there. So where there's 3 different types of SIBO, then the antimicrobials of choice would be a bit different from type to subtype. But generally, it would be working with some antimicrobials that are appropriately selected. In my practice, I use herbs primarily because as a naturopathic doctor, we can't prescribe pharmaceuticals in the province where I live. So, and there are like maybe 2 or 3 integrative medical doctors in the whole province in surrounding areas. So there's no options for patients to access sort of less commonly prescribed pharmaceuticals to address different conditions unless they go to the States or out west in Canada, where there's more liberal prescribing as a rule. So using herbal antimicrobials as a general rule, I'm certainly talking about diet. And with the diet, it's not a one size fits all. It really depends on what's going on with their body type, their morphology, what's going on, and also what's going on in their life. Not everyone can dive headfirst into a really restrictive diet. So we have to kind of take all those factors into account. But generally, it would be that combination of diet and antimicrobials. And then bearing in mind that sometimes there can be those biofilms that I mentioned earlier that affect microbes in the gut too. So if there are biofilms, that's one of the most common reasons, or it's one of the most common reasons that I see patients have these relapses when they're dealing with SIBO or other microbial issues in their gut, or when treatments are basically seeming to fail. So I get a lot of referrals from local colleagues and other practitioners when they're really struggling with cases. And a lot of times when biofilms aren't thoroughly addressed, then that can be a reason why a treatment might not help. But in another, or not be fully successful. But in other cases, it might be that they test positive for SIBO, the SIBO is treated, and then they don't really get much better, and we'll retest maybe and see the SIBO's gone, and evidently the SIBO just wasn't that big of a deal for you. So not everybody, it's certainly feasible to have someone who, well, to put it into case in point, some of the highest levels of gases that I've ever seen on SIBO reports, and in my practice, I've treated around 2,000 cases of SIBO to date. So I've seen a lot of reports. Some of the highest levels I've ever seen have been in some of the patients with the least problematic digestive symptoms. So it just doesn't necessarily correlate. So again, we might test or see what makes sense clinically, but if a treatment's only partially successful, it might be because that underlying cause wasn't a huge driver of the patient's symptoms in the first place.
That's interesting. I've never heard that, like, when you have a pretty good digestive system, that you still are like somebody who can have SIBO. You can still be diagnosed with different types of SIBO. I didn't even know there were 3 different types.
Well, there you go. Learn something new every day.
So can you share more about the 3 different types and what they are exactly?
Sure, I can definitely do that. I need to plug in my laptop though. It's the one thing I didn't do, so just bear with me for 1 second, okay? Or else we're going to have a much shorter interview than anticipated. Just be 1 second. The SIBO subtypes. So there's hydrogen gas producing SIBO, methane gas producing SIBO, and hydrogen sulfide gas producing SIBO. So it's differentiated based on the type of gas that's produced. Hydrogen gas producing SIBO, which is generally the easiest subtype to treat. It's predominantly characterized by more of a diarrhea predisposition. Methane gas producing SIBO is more typically associated with constipation, and then hydrogen sulfide is also typically associated with diarrhea almost exclusively. The kind of strange, ironic, weird thing with SIBO is that all of the gases can have an anti-motility effect, so all of them can ultimately slow down the propulsion of food breakdown products through the intestinal tract, but sometimes it ultimately still manifests as diarrhea, as the body's maybe hitting the emergency switch, saying like, oh, things are moving too slowly, we just got to flush everything out by flooding the intestinal tract with more fluid. So all of them are, to my knowledge, are characterized by a slowing of the intestinal motility, but some of them have more of a diarrhea predisposition. But all of them can cause bloating. Sometimes hydrogen sulfide causes more like sulfury smelling gas. Sometimes methane causes more like just really sort of stereotypical stinky gas. Gas usually never smells good, but the methane would be the more foul smelling of the bunch. And there's some differences there. Methane is usually the hardest type to treat. It usually takes the longest to treat. So there's just a few differences there. And then there's certain, especially in terms of herbs, not quite as much in terms of antibiotics. It's pretty much rifaximin, regardless of the type of SIBO you have, but you might add in metronidazole if it's a methane gas producing subtype, to my understanding. But some of the herbal treatments will be a bit different. So garlic extract might be more applicable to methane gas producing subtype. Berberine might be more applicable to hydrogen or hydrogen sulfide gas producing subtype. Bismuth is more for hydrogen sulfide. So there's just some differences like that.
I see. That's great to know. I mean, I think, the women in this group may have SIBO, they may have IBS and don't know exactly how to go about it. I mean, when you have supplements and eat the food, it's kind of like you don't even, if you're not absorbing it, then does it even make sense to do all that?
Yeah. It's a really good question. That's kind of a lot of my, some of the patients come in to see me, they'll come in saying like, I'm really excited to do this or that, therapy or treatment, or like I've given interviews and talked about like mitochondrial dysfunction. So some people come in saying like, oh, I heard all about your mitochondrial support protocol and all of that. It sounds really great. I want to do that right away. And looking at their case and taking their case, it's like, well, you've got a lot of indigestive symptoms. If you go on these mitochondrial support nutrients, you're probably just going to wind up with more expensive bowel movements and not really going to help you a whole lot. So you really got to get that absorption on track. So it's really important. It's not the it's not as exciting as intravenous ozone therapy, but it is, in my opinion, markedly more crucial to make sure that absorption is happening. So really, really key.
That's great. Good to know. And in terms of just like, these triggers, we talked about some ways to fix them. We talked about your process of how you get started with somebody and how you find out which trigger to work on first. Usually that's SIBO or something that's digestive tract related, whether it's the gut microbiome or fixing the infections, and then what is your process from there?
So if there was a case where they had digestive issues and we worked on that, and then we looked at infections and kind of worked on that, then what would the next step be beyond that?
Exactly.
Sure. And just to clarify, not everybody has digestive symptoms, so we might not start with the gut, or they might not have a history suggesting that there's a systemic infection. But as a general rule, in my experience, at least, the vast majority of cases would have underlying root cause issues that would fit in one of those categories that I mentioned earlier in terms of what might be driving their symptoms. And so once we've started targeting or tackling the root cause or root causes, then it really depends on how the patient's feeling along the way. So sometimes let's maybe leave poor SIBO alone and move over to something else. Let's say it's someone who, they have a mold toxicity issue, and so we've got them on the nasal spray. They're taking binders and liver support and things like that to help metabolize and excrete those mycotoxins. They're killing the mold that might have colonized their sinuses. So they're on that protocol. Well, then the next step would be, and let's just say for argument's sake, they have no issues with their gut. There's no hint of SIBO. There's no hint of chronic infections, anything like that. They're just a straight up mold case. Then after they get onto their mold treatment protocol, about a month into it, we'd follow up and I'd ask, well, how are you doing overall? And if they say, I'm improving rapidly and things are just great, then I probably wouldn't really mess with a good thing, because why add in more things for them to take? If things are moving in the right direction efficiently, then let's just leave it there until you're 100%, or if you hit a plateau, then we'll readjust at that point. However, if that person said, I'm on the protocol and maybe my congestion's a bit better, maybe my systemic pain's a bit better, but it's a month in and I'm still feeling pretty darn tired and I'm headachy and things like that, well, then at that point I'd be thinking, well, mold isn't usually eradicated in the span of 4 weeks, especially since I would have asked them to titrate their protocol up, because you generally never want to jump into a full strength mold protocol lest you have a major detox reaction and feel awful. So they built it up. It's going to take more time to get rid of that mold. But now I'm thinking, well, you're on the protocol, you're tolerating it well, we're seeing some maybe little improvements. Well, now let's see, what are the symptoms that are bothering you the most? And let's see what we might be able to do to help bolster or improve your physiology around that. So if the person said, it's really my energy levels are just bothering me the most, like I can't do all the things I want to do, I can barely function, whatever it is, then I'd be thinking, well, as we're waiting for your body to get rid of that mold, why don't we work on trying to support your mitochondrial function? Your mitochondria make 90% of all the energy in the cells for your body, or in all of the body cells. So if you're feeling tired, your mitochondria are likely not doing well. And so we should maybe look at bolstering those. And yes, we could do some laboratory testing. Something called an organic acid test can be useful to figure out if there's a mitochondrial dysfunction going on. It's a useful test. It's also quite expensive. It's a few $100s US, which is even more expensive in Canadian dollars because our exchange rate is pretty awful. And that's a whole other topic to talk about as to why that's the case. But in any event, so we could do that test, and sometimes we do, or we could say, well, maybe go on some comprehensive mitochondrial support and let's see how you're feeling. And so we kind of I would look at recommending things to help treat those symptoms that are bothering the patient the most. And it's not like taking a natural version of ibuprofen. It's like, oh, just take the energy pill to palliate those symptoms. It's more like, well, why are you tired? Well, your mitochondria are being directly suppressed by those mold mycotoxins, because mold mycotoxins are very toxic to the mitochondria. That's likely how they exert most of their negative effect on a person's body. When your mitochondria aren't working properly, you're going to have more inflammation, more free radicals running around, so more damage to tissues. It's something that could very well perpetuate autoimmune processes. Potentially, there's not as much research around that looking into it as I'd like there to be, but it's just something I've seen in clinical practice. And so by rehabilitating their mitochondria, it's not a Band-Aid solution. It's that, some people, they're on the mold protocol, they hit the ground running, they feel great. But when you don't, maybe it's because your body has been beleaguered by these mycotoxins or whatever it is that's, suppressing your system for so long that we need to give those poor little mitochondria a helping hand. So let's try to boost those up to try to get your energy feeling better. And so if, say, a month later, we follow up and say, yeah, I'm feeling better overall, pain's less, headaches are getting better, and my energy actually doing quite a bit better. It's like, great. If you're getting better fast enough, then let's maybe leave it there. If there's some symptoms that aren't getting better quickly enough, or there's something that's still bothering you that's not moving in the right direction, let's troubleshoot that now. And that might be something else. It might be a hormone balancing thing. It might be an adrenal gland support thing. It might be, there's something I work with called low dose immunotherapy, which is more of a direct immune system sort of re-regulating type of therapy. So that might be something to work with. So there's so many tools out there which are wonderful. It's just a matter of figuring out when's the right time to bring the right tool into the picture. But those would be some of the next step things that I might think about.
Awesome. And, when someone starts working with you, what kind of journey can they expect? Are we talking like 2 years? Are we talking like, is this ongoing in terms of the people you've worked with and cases and results? What have you seen like average time?
It's a good question. Yeah, I mean, it's such a spectrum, of course, but maybe using examples of the most symptomatic patients, if you will, like the patients who are the sickest, let's say, or the most debilitated and have had their symptoms for the longest. It could take anywhere from 6 months to a couple of years to get to the point where they say, like, I'm feeling pretty darn good without a whole ton of extra intervention. Like that would be, and that's a pretty long time frame, but like a pretty broad, quite a spread between those two time amounts. But that would be an approximate answer. There's just so many factors that influence how long it's going to take. One of the factors is, do they have biofilms? Because that can tack on sometimes 1 to 6 months on a patient's protocol. How sensitive are they? I sometimes, not a haha funny joke, but kind of like joke that, I have the most sensitive patients on the planet, because I have patients where one drop of a homeopathic remedy that theoretically doesn't have any physical substance in it could send some of these folks into bed for a week if it's the wrong thing selected. People who are just really, really sensitive. And so those folks, sometimes it takes us the better part of 2 or 3 months to get them ramped up onto a full protocol. I was chatting with a patient earlier today, actually, where she's one of those patients. Like she's lovely, she's dedicated, but man, my heart goes out to her because she's so sensitive. And so, I want to get her to the point where she's taking effectively, a teaspoon, which is 120 drops 3 times a day of this herbal formula that's for going after microbes. And she's finally, it's taken like, I think 6 months or something like that. She's at 20 drops twice a day of just one of the herbs, and it's taken forever to get there. Thankfully, she's able to work with some other things. She's on her mitochondria support, she's on some binders, things like that, and she's getting better. She's getting stepwise better, but it's been really slow trying to get her onto the full protocol. So that's another factor that really influences how long it can take someone to get better. Because if it takes 3 months to get to the full protocol, like, wow, there's already 3 months under your belt. But again, not to say you're not getting better along the way. So it can take a while. There's different curveballs that come along. I also have patients who, unfortunately from my perspective, they have it in their head that they have to feel worse before they feel better. It's a sort of a stereotype that I think is kind of dying out. But I know years ago, pretty much every patient who came in with a chronic infection would say, all the message boards online tell me, like, I have to herx. I have to feel awful for like 3 to 6 months, and then I'm going to start feeling better. It's like, no, that's not true at all. And man, you're going to waste 3 to 6 months and feel awful, dealing with all of this, sort of die off and whatnot. So there's certain things that, it really depends on whether patients are going to try to muscle through flare-ups, which I don't think they should do, whether there's biofilms, how sensitive they are. So there's a number of different variables that influence how long it's going to take to get better, but it's just very, really individualized.
I completely agree. Everyone has their own healing journey. And as we come to the end of this interview, can you share maybe the 3 biggest takeaways? I know we talked about a lot of different things, not just the triggers and how you fix them, but we even went into SIBO. We talked about the treatments and how they help, and even different sort of issues people may have. So yeah, what are your three biggest takeaways?
That's a good question. So, I mean, one of the big takeaways would be that if a person has been, say, someone listening has been dealing with symptoms for quite some time, they've tried, quote unquote, everything. And I say quote unquote because patients come in to me all the time saying, I've done everything and I'm still sick. And we talk and they're like, okay, I haven't done everything. I've done a lot of things, but not everything. If you're sick and you've done quote unquote everything, then it either might be that you maybe tried everything, truly tried everything, but maybe it was in the wrong, not the optimal order, or maybe there are some things that you weren't aware of that you haven't tried or haven't been assessed for that might be going on. So I hope that some of the things I've thrown out there today might be useful to just add to the list of possibilities of what might be driving certain symptoms. So that would be one take-home message. Another take-home message is that, and you mentioned it first in this interview, which is great, that I think it's really important to bear in mind that we really need to look at the body's capacity, where it always is striving for balance. It's always striving to heal. That's what your body's designed to do. Your body is perfect, essentially, in that it's always trying to get into that balance, but it needs the right ingredients to be able to do it. And it can only do that if there aren't a lot of sort of negative forces affecting it, whether it's the wrong food going in down the hatch, or it's chemicals you're being exposed to, or mold that you were exposed to, or something like that. So just remembering that your body is striving for homeostasis, and even when your body is seeming like it's rebelling against you, especially in autoimmunity, it's kind of the classic example of my body's attacking itself. Like, body, what are you doing? There's something that's driving that trigger, and your body is ultimately looking out for your best interest, but sometimes it's having a hard time. So just remembering that, I think, is another take-home message. And then another take-home message would be, which we didn't really talk about because there's only so much you can cover in this amount of time, but is something that I think is important, is just to not forget about the kind of the mind-body connection aspect of things. It's so easy to get bogged down in like, what's the physical cause, what are the physical treatments, all these things, but it's really important to look at that mental, emotional, maybe even spiritual aspect of things, to make sure that you're taking a well-rounded approach. And there's certain therapies out there, whether it's cognitive behavioral therapy, whether it's amygdala retraining. There's so many different wonderful tools out there right now, but trying to remember to have that mental, emotional aspect component, even if it's just a little bit, even if it's just deep breathing for 1 minute a day, just some type of focus on that, I think is really important to round out a protocol well.
Love that. Thank you so much, Dr. Bryan. I would love to have you back again. Seems like we're out of time today, but I'm sure everyone has a lot of questions. And if they want to get in touch with you, how can they get in touch?
So my website is eastcoastnaturopathic.com. I have an Instagram profile, which I post little video clips, not quite as often as I'd like to these days, but about 1 to 3 to 5 times a week, just talking about things. And I'm always happy to, if folks comment on those posts with questions, I'm happy to make video responses to that. Just I want to talk about things people are interested in. So my Instagram handle is dr.bryanrade.nd. It's Bryan with a Y. Rade is R-A-D-E, and then ND is in naturopathic doctor. So dr.bryanrade.nd. And then my Facebook page is East Coast Naturopathic Clinic.
Great. Well, thank you, Dr. Bryan, and we would love to have you back again.
Thanks for having me.